On February 21, 2024, a Russian ransomware group infiltrated a remote access portal. Within hours, the American medical system suffered a total blackout. Pharmacy authorizations halted. Hospitals lost over $6 billion in cash flow in 3 weeks. Small, independent practices faced immediate insolvency as the gears of the system simply stopped turning. Many of the providers pushed toward bankruptcy had never signed a contract or used a single software product from the company that was actually hacked. The target was a massive data clearinghouse processing 15 billion medical transactions a year, a hidden financial choke point owned by a single corporate entity. That entity is UnitedHealth Group. In 2025, they reported $447 billion in revenue, a figure larger than the annual intake of Apple, JP Chase, or ExxonMobil. But the company's internal numbers reveal a strange contradiction. Their actual insurance arm, the business of paying claims, is failing, with margins collapsing to just 2.7%. Yet the parent company is more profitable than it has ever been. The explanation begins with the Affordable Care Act and its medical loss ratio rule. To prevent insurer greed, the law mandates that companies spend 85 cents of every premium dollar on actual medical care. While this federal law caps the profits an insurer can keep, it places no restrictions on the profit margins of medical providers. UnitedHealth bypassed the cap by building Optum, its own provider subsidiary. When a UnitedHealthcare member sees an Optum doctor, the insurance arm records a medical expense, satisfying the law. But the money stays inside the company, flowing into Optum, where it is recorded as uncapped operating profit. In 2025, nearly $190 billion moved internally from the insurance arm to the Optum arm. These transactions are recorded in financial filings as eliminations, billions of dollars circulating endlessly within a single corporate ecosystem. This regulation, designed to contain corporate margins, became the blueprint for a massive internal profit engine. UnitedHealth used this internal cash flow to fund a massive acquisition campaign, buying pharmacies, surgery centers, and data clearinghouses one after another. They now own the infrastructure used to process claims for the very insurance companies they compete against, essentially running the back office for the entire industry. This control over the plumbing allows them to manipulate the float. On average, UnitedHealth collects premiums in 18 days, but waits 44 days to pay out claims to doctors. That 26-day gap represents tens of billions of dollars sitting in UnitedHealth's accounts, earning interest as a permanent interest-free loan from the broader American healthcare system. By owning the rails of the system, UnitedHealth has moved from being a participant in the market to owning the infrastructure their competitors depend on. When the entity deciding whether you receive care also owns the clinic providing that care, the financial architecture creates a $1 trillion incentive to optimize for margins over medicine. Under a reported initiative called Project 7, the company deployed algorithms to scour patient records for past diagnoses. These tools characterize patients as being sicker on paper than they are in reality, automatically extracting higher monthly payments from the federal government. Simultaneously, care denial algorithms like NH-Predict were used to automate the end of rehabilitation for elderly patients. When the computer decided a patient had stayed too long, their coverage was terminated, regardless of their actual physical condition. These automated denials were overturned on appeal over 90% of the time, yet less than 1% of patients ever fought them. This is a system of statistical cruelty. The business model mathematically relies on the fact that sick people are often too exhausted to fight a corporate denial. The Department of Justice is now conducting a criminal probe into these practices, investigating whether the use of these algorithms constitutes systemic Medicare fraud. But public anger reached a breaking point before the courts could act. In December 2024, UnitedHealthcare CEO Brian Thompson was assassinated on a Manhattan sidewalk. The 3 words written on the shooter's shell casings were deny, defend, depose. When the company posted a bereavement message for Thompson, it was met with 77,000 laughing emojis, forcing the corporation to silence its own social media channels. This reaction was a definitive signal that the trust between the American public and the private health insurance industry is functionally gone. Despite the fraud probes and the public outcry, dismantling this entity remains a terrifying prospect. UnitedHealth is so deeply embedded in the national infrastructure that its collapse would likely paralyze American medicine. It remains an automated machine, relentlessly crushing the variables of human health to satisfy the requirements of its own financial architecture. The most dangerous corporations in history do not break the rules, they rewrite them to make their own existence inevitable. Next, we look at OpenAI, a company that began as a nonprofit dedicated to protecting humanity from artificial intelligence, and what happened when it transformed into the very threat it warned us about.